Have you ever felt extreme fear and discomfort that strikes unexpectedly? If your answer is yes, then you might have experienced a panic attack. Now let's take a moment to unpack this unexpected visitor that tends to show up uninvited. A panic attack is a sudden surge of intense fear or discomfort that can peak within minutes. It's like a storm that comes out of nowhere, catching you off guard, even when skies are clear. The symptoms can be quite alarming. Imagine your heart pounding like a drum, your hands shaking as if you've had one too many cups of coffee, and your breath coming in short, quick gasps. It's as if you're running a marathon, but you're standing still. But it's not just the physical symptoms. There's also an overwhelming sense of impending doom, a feeling as if the world is closing in on you. It's like being trapped in a horror movie, except the movie is your reality, and there's no pause button to give you a break. The most unsettling part? Panic attacks can strike anytime, anywhere. You could be in the middle of a dream, nestled in the comfort of your bed, when a panic attack decides to make a nocturnal visit. Or perhaps you're basking in the calm of a quiet afternoon, when suddenly a panic attack swoops in, shattering the tranquility. Despite their terrifying nature, it's important to remember that panic attacks, although intensely uncomfortable, are not life-threatening. They're like a faulty alarm system that keeps going off at the slightest provocation, or sometimes for no reason at all. The tricky part is that these attacks often occur without any warning. One moment you're fine, and the next you're in the throes of a panic attack. It's like walking on a tightrope, never knowing when the rope might give way. Panic attacks can be a terrifying experience, but understanding them is the first step to managing them. So stick around as we delve deeper into this unseen battle, shedding light on the science behind panic attacks, how they affect us, and most importantly, how we can cope with them. Because knowledge, after all, is power. Now that we've defined what a panic attack is, you might be wondering, how do these episodes affect individuals? Panic attacks can have a significant impact on a person's life, and this impact is threefold: physical, emotional, and social. Physically, panic attacks can feel like a heart attack, with symptoms such as rapid heart rate, sweating, trembling, shortness of breath, and chest pain. These symptoms can be quite distressing and can even lead to other health problems if they persist over time. Emotionally, panic attacks can lead to feelings of fear and anxiety. These feelings are often intense and can be overwhelming, leading to a sense of dread or impending doom. This can cause a person to constantly worry about when the next attack might occur, leading to a state of constant anxiety. This constant state of anxiety can be debilitating, leading to difficulties in concentrating and making decisions. Socially, panic attacks can lead to avoidance behavior. This means that individuals may start avoiding situations or places where they fear they might have a panic attack. This can disrupt their daily life, as they may start to avoid social gatherings, public places, or even work. This can lead to isolation, loneliness, and can even impact a person's career. Moreover, panic attacks can also lead to other mental health disorders, such as depression or other anxiety disorders. They can also lead to substance abuse, as some individuals may turn to alcohol or drugs to cope with their anxiety and fear. In essence, panic attacks can disrupt a person's life in many ways, affecting their physical health, emotional well-being, and social life. They can cause a person to live in a constant state of fear and anxiety, disrupt their daily routines, and even lead to other mental health problems. But despite how overwhelming they may seem, it's important to remember that panic attacks are not insurmountable. With the right help and support, individuals can learn to manage their panic attacks and lead fulfilling lives. Panic attacks can have a profound impact on a person's life, but remember, they are not insurmountable. So what exactly happens in our body during a panic attack? Well, let's delve into the science behind it. Panic attacks are an intense and often overwhelming response to fear or stress. They are essentially the body's fight-or-flight response on overdrive. This response is a survival mechanism that prepares us to either confront or flee from danger. When you perceive a threat, your body springs into action. The adrenal glands release adrenaline, also known as epinephrine, into the bloodstream. This hormone speeds up your heart rate, increases blood flow to your muscles, dilates your pupils, and slows digestion. All these changes prepare you to respond to the danger. It's like your body is a car and adrenaline is the gas pedal. At the same time, your brain is also making calculations. It's evaluating whether the situation is truly dangerous or just a false alarm. If it's a false alarm, the brain sends signals to slow down the adrenaline release and calm the body. However, in the case of a panic attack, the brain incorrectly interprets these signals. It perceives a threat where there isn't one. This misinterpretation leads to an excessive adrenaline release, triggering the intense symptoms of a panic attack. It's like your car is revving up, but there's no actual road to drive on. This process is not just biological, it's also psychological. Your thoughts and emotions can feed into this cycle. For example, if you're feeling anxious and start to worry about having a panic attack, this can trigger the fight or flight response, leading to a self-fulfilling prophecy. So, panic attacks are a complex interplay of biology and psychology, a dance between your body and mind. They're not a sign of weakness or a character flaw. They're a response to perceived danger, even if that danger is not real. Understanding the science behind panic attacks can help demystify the experience and reduce fear. Panic attacks might seem overwhelming, but there are ways to cope. Let's first address one of the most immediate techniques: breathing exercises. When a panic attack strikes, your heart rate may escalate, and your breathing might become shallow and rapid. To counteract these symptoms, you can engage in deep, slow breathing. Imagine inflating a balloon in your belly as you inhale, then slowly let the air out as if you're deflating it. This simple act can help regulate your heartbeat and instill a sense of calm. Another coping mechanism is grounding techniques, which are designed to help you stay connected to the present moment. Panic attacks often create a sense of disconnection or fear of impending doom. Grounding can help pull you back into reality. Try to focus on the physical sensations around you. What can you touch? What can you smell? What can you hear? By concentrating on these tangible elements, you can help your mind steer away from the panic. Now, while these techniques can be useful during a panic attack, it's also important to consider long-term strategies. This is where cognitive behavioral therapy, or CBT, comes into play. CBT is a type of psychotherapy that helps you understand and change thought patterns leading to harmful behaviors or distressing feelings. It can be particularly effective in managing panic attacks by helping you change your response to triggers and anxiety-inducing situations. However, it's crucial to remember that if panic attacks become frequent or severely interfere with your life, seeking professional help is a must. Mental health professionals can provide a range of treatments, including medication, therapy, and support, tailored to your specific needs. Remember, it's not just about surviving a panic attack, but learning how to thrive in spite of them. You're not alone in this journey, and with the right tools and support, you can learn to navigate through the storm of panic attacks and come out stronger on the other side. Panic attacks, while challenging, do not define you. Let's take a moment to reflect on what we've covered so far. We've journeyed into the unseen battle, understanding the intense fear and discomfort that can strike without warning. We've explored how these episodes can affect us, physically, emotionally, and psychologically, disrupting our daily lives. Diving into the science behind panic attacks, we've gained insights into the biological and environmental factors that contribute to their onset. And we've seen that there are coping mechanisms available, from deep breathing exercises to cognitive behavioral therapy, that can help us manage and even prevent these attacks. The path forward may not always be easy, but remember, you're not alone. Reach out to loved ones, consult with professionals, and seek the support you need. Understanding and managing panic attacks is a journey, not a destination. With knowledge and the right tools, you can navigate the storm of panic attacks and come out stronger on the other side. Thanks for watching, and please like and subscribe to receive more videos like this one.